Here is your podcast script. A shortage of chemotherapy drugs is bringing rationing fears for cancer patients across the United States. Doctors treating cancer patients nationwide are now facing critically low supplies of some of the most essential medicines in oncology, decades-old generic chemotherapy drugs that form the backbone of treatment for a long list of cancers, including breast, lung, ovarian, testicular, bladder, colon, and head and neck cancers. The shortages are being driven by a combination of manufacturing problems, shipping delays, and decisions by some companies to simply stop producing these medications altogether. The Food and Drug Administration says these older drugs are difficult to manufacture in sterile facilities, and they command very low prices in the U.S. market, which discourages companies from making them in the first place. The situation is already dire for one drug in particular, ifosfamide, an injection used to treat sarcomas, lymphomas, and testicular cancers. Doctors are already convening to decide who gets access to it. Dr. Andrew Schumann, a head and neck cancer surgeon at the University of Michigan, put it starkly: there are patients who won't be able to receive this drug even when it is their best option. In Michigan, some doctors are already prioritizing younger patients with a chance at full recovery. That is rationing, happening right now. And ifosfamide isn't alone. Cisplatin, carboplatin, and oxaliplatin are all in tight supply. Premier, a company that negotiates drug procurement for roughly 4,200 hospitals and health systems nationwide, says its members have seen only 38% of their ifosfamide orders filled, and about two-thirds of their cisplatin orders. Some cancer clinics have responded by spacing out the time between doses and scheduling patients back-to-back just to make sure not a single drop of medication goes to waste. The FDA says it is working on solutions, including temporarily allowing imports from foreign manufacturers that don't normally supply the U.S. market. One manufacturer, Baxter, which relies on a facility in Halle, Germany for its ifosfamide supply, had FDA inspectors discover sterility problems there last year, bacteria in a filling area and, remarkably, a forest cockroach elsewhere in the plant. The FDA issued a warning letter in March. Baxter says supply of ifosfamide is not expected to return until October. This is not the first time. 3 years ago, carboplatin and cisplatin went into a months-long shortage that triggered heated discussions in Washington about finding lasting solutions. Laura Bray, executive director of Angels for Change, a nonprofit working to address drug shortages, said flatly that not a single systemic policy change has come from those discussions. Her organization has helped fund domestic manufacturing of some shortage-prone medications, and the Mark Cuban cost-plus drug company recently began making carboplatin at a Texas facility. Bray believes there is enough supply to go around if providers avoid panic buying. But Dr. Schumann and others argue the real problem goes deeper: an aging manufacturing base, a complex payment system that distorts the normal forces of supply and demand, and a decade of conversation that has produced almost no structural reform. As he put it, these shortages are going to keep happening until we address the root cause. Cancer patients and their doctors are caught in the middle, and for now, the answer from Washington remains largely silence.